Welcome back to my channel, Psych DNP student. I'm Nurse Jackson. I'm driving home from work, and I just wanted to kind of chat with you guys while I'm driving about what happened at work today. Today I worked on a geriatric floor, and we were short-staffed, so that made it a lot more difficult, actually a lot more challenging, but it worked out. I had a patient today who had to go to another facility for treatment. So that's called a detail. So when the patient has to go out on a detail, they have to have an escort, and the patient has to also have a consult. And the consult basically consists of a copy of the patient's most recent physical assessment, a copy of her psychiatric assessment, a copy of her most recent lab report, as well as medication list. And there also has to be a Medicaid eligibility form included in the packet so that the provider can receive payment for services. So we had that the first part of the morning, and then I had treatment team meeting. And of course, when I'm doing my notations or working on my report, you have different treatment team members coming to the unit, and they're constantly taking charts and documenting, putting charts back. So we had the psychiatrist, the medical doctor, the social worker, the dietitian, we had recreation aid, everybody coming back and forth, taking charts, putting them back. So it was very, very busy and kind of hectic in the nurses station. The nurses station is only but so big, and with COVID, it's very difficult to actually practice social distancing and to be 6 feet apart. So we had that go on today. And also on the unit that I worked on today, I had one of my patients had a G-tube. And when a patient has a G-tube, that means that they can't take meds PO by mouth. So their medication has to be crushed and administered through the G-tube as well as the patient's feedings. On this floor today, many of our patients required assistance with their ADLs, and when it was lunchtime, we had to feed some of the patients and, just basically help them with all of their daily needs. So the day went well for the most part. At the end of the day, it got kind of interesting. Right before it was time for me to leave, I had one of my patients. She actually came out of her room naked in her wheelchair, and she went into another patient's room, and she pulled down the patient's blinds. So this patient was very agitated. She was combative, and she was not easily verbally redirected. So I had to call for assistance. And basically, when you call for assistance, it's like the cavalry comes in and they'll assist with the patient to try to de-escalate the patient. When you can actually de-escalate the patient by talking to the patient, speaking to the patient calmly, and redirecting the patient so that, the behavior, so she becomes less agitated, that's the best case scenario. You don't want to have to give the patient an injection unless it's absolutely necessary. And now, when it comes to injection, medical certification and emergency certification has to be completed by the psychiatrist before the patient can even receive an injection for agitation. There's also the option of giving a PRN by mouth for agitation if the patient will agree to take it. It all worked out, nevertheless, because the patient, once I called for assistance, the patient decided to go into the room and she laid down. So it worked out, and that's pretty much it, guys. I wanted to kind of just touch base with you and let you know how my day went, and that's pretty much it. Have a great weekend and take care. Remember to subscribe. Bye-bye.